Good morning, everyone. I'm Gina Sudam. I'm the president of the Wyoming County Chamber of Commerce. Thank you all for joining us. We are recording this morning's session and we will post it later today to our Facebook page, and we encourage you to share it. What our purpose this morning is just to give everyone some information and a quick update on COVID in Wyoming County and the vaccine situation here in Wyoming County, and get some insight. So I have with us this morning, of course, Representative Karen Boback. Thank you for joining us. We have Jean Dezak, the Director of the Emergency Management Agency, and we have all three of our county commissioners. So thank you, commissioners, for joining us as well, and thank you to Jean. We will be joined as well, if she can make it, by Senator Lisa Baker. So we're watching the waiting room for her to join us as well this morning. So let's get started first with Representative Boback, because several of us on this call this morning sit on what we call the Wyoming County COVID-19 Task Force. And that was something that Representative Boback came to us and asked if we would participate in. So could you tell us, share for the audience, what is the purpose of the Wyoming County COVID-19 Task Force and who is represented on that task force? Oh, unmute yourself, I'm sorry. There you go.
The idea originally, when we were having problems with doing our best to get out of a red phase, at the time it was red, yellow, green phase, and the incidence of COVID was very, very slim in Wyoming County. And we were working hard to get at least into the yellow stage and then, of course, the green stage. So that prompted me to ask the leaders of the county. I asked 12 in particular, myself included, the commissioners, the head of the hospital, Eugenia, with the head of our business and industry, of course, Jean Ziak, the head of human services, human health services. The DA was asked, and Senator Baker, of course. I think I have everyone there, and the two superintendents of the school systems, because I try to create a niche of everyone that was starting to make decisions, with us being again in the red phase, going to yellow, going to green. So the idea was to get a discussion going on our next steps to keep, of course, our constituents safe, and how do we get to the next step. And I feel we accomplished great goals. It was a discussion on a weekly basis overall, and to watch our schools progress, to watch our businesses reopen, to see the health and safety remain vigilant in the county. And that's how it all began. And it was wonderful discussions weekly. Where do we go from here? What's been working? What isn't working? What is coming down from the administration of the state, the governor's office? How do we incorporate that? And I feel it's been very successful so far, but we keep on keeping on. Right now, the big question is the vaccination, getting vaccines, getting a distribution center overall in the county. We do have several that offer vaccines, several different venues, but we're looking for our own mass vaccination site. So that's our quest.
Good. Thank you so much for sharing, Representative. I really appreciate it. And I know that you have another obligation today, and I appreciate you taking the time with us quickly this morning. So if we do see you drop off, we understand that you're going to speak to the governor and on a women's event, right? This morning, is that?
Yes, today, in fact, today we're honoring our female veterans throughout the Commonwealth and doing the history of women becoming veterans and going back to the Revolutionary War. So thank you. Thank you.
Well, thank you again for taking the time to join us this morning. We truly appreciate it. Jean, I'm going to go to you next, because there's a huge spike recently in cases, obviously front page of our paper, where it seems to be affecting, all industries, our school, but our big and our small businesses. So what can you tell us about this surge? Where are the cases coming from? Is contact tracing helping you to kind of discover what's going on?
Yeah, thanks, Gina, for having me on today too. Just to give you some numbers here that have been updated this morning. We are at 1,376 cases. We're at 44 deaths. 1,376 is an overall count since this thing started. However, from the 22nd until yesterday, the 28th, we are up 92 cases. So that's an average of about 13 a day. Um, so yes, there is a spike going on. I just got off the phone with our local Department of Health, and what we're seeing is a sporadic cases throughout the county. There's no pinpoint breakout, if you will. Um, long-term healthcare facilities are um, pretty much holding their own. We haven't seen any, um, outbreaks there. Yep, the school is definitely having issues, and it seems like it's students and parents. So right now we're on a climb. Um, and in answer to your next question,
Let me ask that next question because the audience doesn't have those. So
oh, okay.
my next question for Gene, and I did kind of prep him, but what can we do to reduce the rising case count, right? So we see this rise, and then again, we're hearing a lot on the news about variants of the virus. So do you know if what we're seeing here are variants of that initial virus, and is there any way to
we don't have any information that the variance is adding to our cases.
Okay.
We do know there's been some traveling. There's been activities through the school with district and state championships. Students going to Harrisburg for state championships. We can't pinpoint that the virus was carried back from that as of yet. Like I said, this has been a week and we're at 92 cases, so there's a lot of work being done through DOH to see if we can start to pinpoint this a little bit closer. What we need to be doing is going back to our original precautionary measures of wearing masks, social distancing, washing hands, avoiding large groups. I know there are people in Wyoming County that's been vaccinated, and that's not a big percentage. So we need to be very careful with social distancing. And the mask thing is big. I did talk to DOH this morning about the flu situation, and flu situation this year is down dramatically from what it was last year. And I asked the question, well, why do you think that's happening? And they said, people have been wearing masks, but we need to raise that awareness still. We can't drop our guard, and if we drop our guard, we're going to see these numbers continue to rise. I know I transported an individual over the weekend that was COVID positive. And I know, listening to the calls throughout Wyoming County, we are transporting COVID positive cases.
And again, what I'm hearing a lot of is, well, I've had it before, I have the antibodies built up, or I think I had it already, so I'm not worried. Those things are not protecting us. The only thing that is proven to kind of protect us is truly getting this vaccine. I'm going to move on to talk a little bit about that vaccine right now, because we spoke again as a group last week, and the state is looking at doing regional mass vaccine sites. And I want to talk to our commissioners a little bit about this, because you realize, of course, being our rural county commissioners, you realize that transportation in Wyoming County is hard enough, getting people from point A to point B within the county. Um, what have you done to kind of advocate for a Wyoming County um, COVID vaccine site, not these regional vaccine locations?
Yep. Okay, this is Rick. How you doing?
Good,
We've been
how are you?
actually doing a lot of lobbying on behalf of our residents. I talk to Karen almost on a daily basis. If I don't hear from her, I think she's mad at me. I don't know. And I talk to Lisa quite frequently too. And they are down in Harrisburg pushing the Department of Health and PEMA to get the vaccinations on a local level. I know that they're both pushing hard for that. Last week, we went along with 8 northeastern counties. We joined together and sent a letter protesting the action of to Governor Wolf, Department of Health, and PEMA, and demanding that even if they decide to go regional, it must include local vaccination sites to ensure our elderly don't have to travel long distances. Also, in the latest state proposal, they want to allow 1B at the regional centers, even though many 1A have not been vaccinated yet. That decision was also included in a major issue in our protest letter, and we are absolutely opposed to that as well. We've been doing everything we can. We've been calling people. We've been writing letters. Gene, I know, is on with the Department of Health daily. He's been on with PEMA. We have, I don't know how often we have open meetings with PEMA and Department of Health. But they still seem to be, in my opinion, ignoring our wishes that we want it to be local. Karen and Lisa, I know that we talked about that, and they seem to be pushing that they want to go with a regional effort, and we are absolutely opposed to that if it does not include local.
Right, even if they do a regional, we're asking for an amount of those shots to be given to us in the county too. We did all the footwork, we did everything we needed with Gene, and we bought the equipment. We're ready and set to go. We were one of the first counties approved to do this. Listen to us counties. There's 8 of us on this letter, and I'm sure there's more that really need to make sure that our elderly are taken care of. They don't want to travel. They don't want to put themselves in that situation on a bus with a bunch of other people, and it's just a common sense kind of thing that we're hoping to do. That's why we were so eagerly joined with all these other counties to ask for help. And not to say that we're not getting it. Our representatives, everybody has been right on the same thoughts as we. So let us do it.
And one other thought, we were told by the director of FEMA that if they hold a site at the arena, they can do 3,000 to 4,000 shots in a day. My opinion is if you gave 8 counties that went together 400 or 500 shots to give, we can do that much or more in a day, much more efficiently for our people. And that seems to be the point that they are missing.
Right. Well, we truly appreciate your advocacy on the behalf of the Wyoming County residents. And it's certainly, I feel, and I know our whole task force feels, that it is important for us to have a local site here in Wyoming County. And Gene, I know you and your team have worked very hard to get that set up and ready to go, working with the Rotary of Tunkhannock to get volunteers ready and at the helm. So I know we have, at my last count, again, because I'm a part of the Rotary as well, we had about 150 volunteers ready to go. We're just waiting for a date on when we would get these vaccines. So Gene, is there anything you want to add about, what a mass vaccine site would look like or what that would mean to our county before we move on to the next question here?
Sure. We at noon today, we're going to be meeting with a local medical center that seems to be able to tap into the vaccines. We're going to meet with them this afternoon and see if we can arrange a vaccination site. In fact, there's 2 of them, and it won't be large site. It may be about 400 vaccines, but that's still 400 more we can get into arms. So we are going to go meet with them today. We are working a vaccination site at Tyler, and that'll be vaccine coming directly to Tyler. We're also working the max vaccination with DOH, which seems to be stalled. And I don't know why that's stalled, but if that happens, we're looking at hopefully 500 to 1,000 vaccines, which we have. Well, let me put it to you this way. If we have over 1,000, we've got a site ready to go. If we've got 500 to 1,000, we got another site ready to go. And if we have 200 to 500, we got another site ready to go. We have all our sites picked, ready with the volunteers to get this done. So, again, what I've been saying over the last month or so is give us the vaccine. We're ready. We're Wyoming County set.
I know it was a lot of legwork that went into that. So we truly appreciate it. I know that we were, in fact, one of the very first counties that had a plan ready to go.
Yes.
And approved. So we commend you for your leadership in getting that done for us early on.
Thank you.
Gina, I want to move to talk about those in Wyoming County who cannot get an appointment for a vaccine right now. So we talked about, the hospital is getting a couple 100 or 100 or so a week. There are some other places like Rite Aid and Weiss. What do you suggest to those who are really struggling to get a vaccine right now? Is there, suggestions that you might have for them?
Yeah. First of all, they should consult their family physician, because some of these family physicians do have a connection to some vaccine. And my best suggestion to those folks are just keep trying. That's what I've been telling people that's been calling here. I know the commissioners have got a list going. Keep watching the internet, and wherever they can hit an appointment, grab it. For people in Wyoming County that are not going to be able to deal with the internet, are not going to be able to connect to the link, call the Department of the Bureau of Aging in Wilkes-Barre. There's 2 numbers. I know that I don't have them right here in my fingertips.
It's on our website too.
Yeah, it's on our website too.
And I've got them
That's
right here, okay, if anybody wants them, 570-822-1158. Call that number, even if you don't have a computer or a smartphone, they will enter you into the state's database. That way you don't have to do it.
And that was 822-1158. I'm just going to put that in the chat.
That's correct, 570-822-1158.
And that number is a little difficult too. You may have to try 2 or 3 times,
It's
but
busy.
you'll eventually get through.
Okay, and that's for those that don't have internet to make their own vaccine appointments, correct?
Correct.
And if you do have access, you can go to the www.health.pa.gov. If you click on COVID-19 vaccine, and then it will pop up, where can I get vaccinated? That map will pop up. I know we're all familiar with that, Gene. The map will pop up, and in Wyoming County, we'll have little circles where the various locations are. What we are telling people and suggesting strongly is you sign up for all of them. Then when one pops up that they've got something available, you will get called. But then we ask you to please call back the other ones and tell them, hey, I got my vaccination, so you're not on a bunch of lists. Obviously, if you try on 5 or 6, you may forget one, but if you can get as many of them off there as you can. Right now, that's the best way. Call the Department of Aging, let them put you on. If you can't get on, go to health.pa.gov and follow those directions. COVID-19 vaccine, where can I get vaccinated? And those are the 2 best ways to get on a list as of right now.
It took me 4 days to get my wife on there, but I did, and she got her shot Friday.
Obviously,
so-
the best is to have a mass vaccination site in Wyoming County, but right now we don't have any control over getting the vaccine, and that's what we're waiting on. But we have to
Sure.
leave the system that's there for the moment.
Thank you.
You're welcome.
Thank you, Representative. thank you to the commissioners for that information. I think it's very important. Again, the representative had to go and give her commendation. She was presenting to women's veterans, so very important, and we thank her for jumping on with us this morning. And we do have here now with us Senator Lisa Baker. And Senator, so we've been spending some time this morning talking about the rising COVID cases in Wyoming County and about vaccines and the scarcity of vaccines here in Wyoming County. But, you know, it's really a scarcity of vaccines across the state. Seems to be more so in rural areas, but I know it's not just rural areas. I've talked to my colleagues throughout the state, and it's really all over. So what is kind of being done in Harrisburg to help us, right? To help residents of Pennsylvania get these vaccines in their arms, right? We're at 10% across the board if you scan all the counties. It's not acceptable.
Thank you, Gina. I had trouble getting on my computer, so I'm doing this from my iPhone. So I hope you can hear me okay, and just want to apologize for not getting on a little sooner. I have to take a couple seconds to acknowledge the good work of the commissioners and my colleague together with Jean Ziak. We have been pushing and fighting for rural communities. As you know, the Department of Health took a step back and is pursuing this mass vaccination site in Mohegan Sun Arena. And while that may make sense for people who live in Lackawanna or Luzerne County, it certainly doesn't make sense to the counties I represent, the rural counties like Wyoming, like Susquehanna, Wayne, and Pike. And the commissioners articulated that very, very well. We had a Zoom call on Friday with the executive deputy of the department to lay out our concerns and our frustrations, to talk a lot about where we see problem solving. We know what the problem is. We know that we're running way behind in vaccinating eligible seniors in rural communities. We have a plan, and we want to problem solve. And I think the commissioners and Jean have articulated that very well. The department has indicated as a result of that advocacy that they intend to go back and look at trying to find the resources for us to have our own clinic in Wyoming County. That is our goal. That is the optimum goal for both Wyoming and Susquehanna County. I think they've talked about the transportation challenges, the difficulty putting a 95-year-old on a bus to the arena. It just doesn't work, doesn't make sense, and it doesn't fit for us. The other piece that I was happy to hear that the acting Secretary of Health is considering a pilot initiative for rural Pennsylvania that will be focused on homebound seniors, which when you just asked the question of Jean to go looking at the Area Agency on Aging, if we can get as many of our seniors registered with the Area Agency on Aging, it will then help us focus and target on a homebound initiative. So they don't have the game plan fully worked out, but I think in combination with a mass clinic for Wyoming County and a homebound initiative, I think we can address the gap, the real serious gap in seniors in Wyoming County. So the advocacy continues. I've been working with my colleagues who serve on the vaccine task force with the department, and they are hearing loud and clear that rural Pennsylvania needs a different approach.
And I'm so thankful for all the work you've done in that. And it's great to hear that there is a homebound approach. One of the things that we realized early on here in Wyoming County, and our commissioners certainly supported, was our food emergency distribution. There were many seniors that couldn't get out to go to the grocery store safely. So again, how do you put that 95-year-old on a bus and you can't guarantee that no one else on that bus has COVID riding down there with them, right? It's
Correct.
just not acceptable. So I'm very
It
thankful.
doesn't make sense. And I think that the commissioners and Jean Ziak have done a tremendous job with the partnership with the Rotary. And, we do have a plan. We've had a plan, and Jean has been touting this for some time. We have a plan. We have the people in place. We have the wherewithal to do it. I think there was frustration when they pulled back on local pharmacies and picked a limited number of providers, which doesn't make sense to me. We have a willing provider in our hospital, and we have seniors have relationships with their pharmacies. We have huge waiting lists at these pharmacies. So my understanding is they pulled back for a period, and that they will restart that at the pharmacies. That couldn't come sooner. I think we all would agree with that. But we're pushing, we're advocating, and I think, the department, I hope the commissioners would agree, seemed more inclined when you have strength in numbers. We had county commissioners from all 4 of the rural counties in my Senate district saying the exact same thing. And I think they heard us. We're going to continue to push for that, and just want to thank them for their terrific leadership and advocacy to get this moving. It's been frustrating, though, challenging and frustrating. And, people say to me, boy, how did New Jersey do a hotline and get everybody registered? And, why didn't we take a similar approach? And I can't answer that. I don't know why we didn't do that, but it certainly would have made better sense. We know the problem, let's problem solve, and we've got the right people who are planning to do that.
Sure. And I think, one thing, and someone just posted, the why is this happening, right? And I think as we've talked as chamber directors from across the state, and I think, the why this is happening is we're not talking to the local people, like our EMA directors and like our county commissioners in local areas to say, how can we do this? This has all, since the beginning of COVID, this has been decided by one person and one administration that has not listened to those that represent our counties, and not been able to say, how can we truly help you? What can we do? Not taken the advice of those who are on the ground. So
I think
that's the why,
that's
in my opinion.
I think so. And the top-down approach certainly never works well. It's got to be collaborative. And, one of the strengths of where we live and who we are is that rural communities collaborate, and people come to the table and are about fixing problems. They're not about passing it off. So I'm hopeful. We're still pushing. I think the commissioners, their letter asking them to redirect some of the doses. The other thing that I have asked the chair of the Health and Human Services Committee, as well as the representative to the task force, look at who's receiving the vaccination with the data at the Mohegan Sun Arena. And I'm sure the data is going to prove that the rural counties are not coming there in strength or in significant numbers. And if that's the case, redirect those doses out. Use the data to show that our folks aren't making that trip and aren't traveling, and redirect it based on fact, based on data. And so that is part of the request as well.
Sure. And they certainly won't be the 1A folks that are making that trip down to Mohegan Sun.
I don't see that at all. And for some people it's 80 miles round one way. Some cases, I just know from caring for an elderly family member in our home, the last thing I would have ever wanted to do is put her on a bus, into into that setting. Couldn't physically do it. So
Sure,
we're going to.
not only to mention the logistics of that, right? So how long are you gonna wait in a line? And then what about restrooms, right? For elderly, they've got to use the restroom often. So what do you do in that situation? It's, again, just not conducive. So we truly appreciate the advocacy and want people to realize the big picture of this advocacy. It's not, it really is for our residents. It's not because we're being selfish or trying to get something in our county that isn't for you. This is really all about you, our residents, and making sure that we have what we need. I do want to have a little bit of time for questions from the audience, but I have one more for Jean that I think is kind of my last question, and I know you touched on this earlier, but can we just remind everyone the best ways to protect themselves, especially during our most recent surge in cases? Because I think sometimes, now that we're, over a year into this, we're starting to get laxed. I hear all the time, I'm sick of COVID. Okay, well, you're sick of COVID, but you're not sick from COVID, right? So let's keep protecting ourselves. Do you want to kind of go over those key points again?
Again, it goes back to what we were doing when we got into this mess. We need to be wearing masks. We need to be wearing masks. We need to make sure social distancing is in place. We got the Easter holiday coming up. According to the CDC and the Department of Health, it's okay to be doing family gatherings. Be a little careful as you're doing your family gatherings. Try to social distance as much as you can. Washing your hands is a big thing. Make sure that your hand sanitizers are available. Make sure you're washing your hands, and protect yourself and someone else. Even though you may be vaccinated, wear the mask. You're protecting someone else. That's the big thing that we need to be doing. And I think Karen and Lisa both have heard this before. Advocate for Johnson & Johnson to come to the rural counties. All of a sudden, everything J&J is now has been directed towards the 1B categories in the mass vaccines. Moderna and Pfizer are going to go to the 1As. Why should we be trying to get our senior citizens to get the second dose when J&J is available? I mean, when J&J was released, that was one of the things that clearly came out of the state was we need to push J&J to the rural counties. It's not happening.
Thank you, Jean. I'm going to open it up for questions from the audience. I think it might be best to try to use the chat, or you can unmute yourselves if that's easier for you. Again, if the commissioners or Jean or Senator, if you have anything that you would like to add that we didn't touch on, certainly feel free.
Just one thing I wanted to share with all of you, knowing that the summer camp industry is a huge part of northeastern Pennsylvania. I have written a letter to the governor seeking release of guidance so that our camps can reopen for the summer. We have asked that be issued before April 1, because many camps, you don't just show up on the first day of camp. There's a lot of preparation that goes into it, and we're awaiting the governor's release of that. But all the camps that I've talked to have indicated they're going to be following CDC guidelines and mass social distancing, vaccinations, and the like. But a huge industry for us, over $120 million industry in northeastern Pennsylvania. And so I just share that we are awaiting that guidance and hoping that will be issued before the end of the week.
And I just a point to touch on there, because you did mention vaccines. The vaccines again are for 18 and older. So children are not getting vaccinated before, or
Correct.
would be required to get vaccinated before they went to camp.
That's correct. It's just the staff and others that they're going to be looking to.
Very good. Thank you. I just wanted to make that clarification, because I did have some
Thank
people ask about their child is working in the food industry or grocery industry, and they're kind of worried about them if the grocery workers can get vaccinated, but not if they're under 18. Commissioners, did you have something you would like to add?
Just that I think it's important again, because it's a little confusing. Some of the people that are calling are saying that now that they're vaccinated, they can't carry the virus, or they don't have to wear a mask now. And I think it was a little confusing there for a while. So I think it's important when we have people on the press and stuff here to let people know that it's still important to wear the mask, that it's still, you can be a carrier, and that you can, I mean, I think we still have to educate people more. We had to teach people how to wash their hands again. I mean, so it's important that we keep this up until we don't have to do it anymore.
That's a
and that's
great
my
point.
mother speaking through me, I think. She calls me all the time concerned that,
Sure.
that people aren't following the rules now. They think they're
Sure.
okay now that they've gotten vaccinated.
No, and that's truly a great point, because we are, people are getting vaccinated and we're seeing, the case count rise. So I think it
Right.
is important. I will look for guidelines. And Jean, if you have any, I know I was sent home with guidelines after the vaccine, but I will look for those guidelines online and see if I can't post something when I
That'd be
post
great.
today's webinar, to make sure that, even though you're vaccinated, wear your mask, practice social distancing, all of those pieces, so that people do understand. Anything else that anyone would like to add, or questions? Any idea when the Johnson & Johnson shot may be available in our area? And I do know that the J&J shot was available in our area to school teachers. And that was a directive from the governor, that all the J&J shots were directed to educators only at this point. Do you comment on this, Jean or Lisa? Do you know any more about J&J shots being available to those beyond educators at this point?
All J&J has been directed to the 1B category. Again, that wasn't the way that was supposed to go. It was supposed to be.
We certainly raised that issue with the department on Friday. I think I can speak for Jean and the commissioners and others that, it makes sense maybe once you get through the educators that you target, that Johnson & Johnson for the homebound senior, so that you're going to try to visit one time. And I'm anxious to see if we can put a plan in place to help do that, so that we completely address the 1A senior who is the most vulnerable, and where we've seen the most loss of life. It makes, to Jean's point, it makes no sense that we're not targeting the 1A seniors who are the most vulnerable. They're the ones we've lost, and that's who we should be completing and finishing up. And it would make sense to try to do that as soon as we can. So we've been pushing.
Definitely. Well, again, I just thank everyone for their advocacy, for continuing to push on the administration to say, there is a different way that may be a little bit easier for all involved. With the case count trending upwards, can we still expect Governor Wolf's lifting of restrictions to take effect on April 4th? So the governor has said, and as many of you know, and I'll just reiterate for those who may not know, the governor has said that our restaurants may open at 75% capacity if they're self-certified, 50% if they're not. That there was some lifting of return to work restrictions, the work from home restrictions, I think were included in there. I'm trying to remember what else. Lisa, you may know a little better than me.
I think the most important piece of that is for the small business owner, and the key piece of it for them is the 75% if they're self-certified.
Are you hearing that he is still going to lift those restrictions? Or are you hearing anything different in Harrisburg about those restrictions?
I'm hearing that they're still on track to remain lifted. I have not heard any or been given any indication otherwise. And I think commissioners on the call, she indicated that they were still moving forward with that.
Yes.
Thank you. We appreciate that, and I do hope so. I think our restaurants are kind of the most protected place, right? You can't get up or down without your mask on. You know, you're sitting with people that you know, and of course your servers are masked, and they follow such strict safety protocols. And I know some of our local restaurants had some incidents and they threw out all of their food. So imagine, right, on top of they've been devastated for months and months, and their strict restrictions as far as how many people they could serve. And they had an incident or two within the restaurant and literally threw out everything just in case, right? So they are protecting us and they are being very careful. And I do think it's been very unfair what has happened with the restaurant industry. So I'm thankful and hopeful to see the opening back up of that industry. But again, would caution people to, you know, be aware of who you're going out to eat with, and be aware of who you're gathering with. Because I think it is important, and be cautious, wear your masks, and make sure that you're washing your hands and doing all those things to protect yourself and others. Anything
Just
else?
one thing, Gina, that I would mention, that we have reintroduced the Safe Harbor limited liability protection legislation that the governor vetoed last year, that more than 70 organizations, including the Chamber of Commerce and so many organizations are in support of. Colleges, universities, Little League Baseball, you name it. Our nursing homes, our hospitals, and others are seeking what we call safe harbor limited liability protections, that if you're acting in good faith, following CDC guidelines, you would be protected from lawsuits only during this pandemic timeframe. And we're hopeful that we can revisit it, run the legislation, and perhaps encourage the governor to support that. Every small business owner that I have talked to is worried about the potential risk of a lawsuit down the road. It's a 2-year statute of limitations, and so we're in year one. People are concerned whether you're the barber, you're the flower shop on Main Street, you're the nail salon, you've done everything properly, you're the nursing home. And quite frankly, if we speak about the nursing homes, in my judgment, it's the policy of state government that really put many of those families at risk when they forced nursing homes to take individuals back in who are COVID positive. And so I don't think we should be holding them hostage or the potential of difficult lawsuits. If you're following the guidance, you're doing the proper things, you're not a bad actor, you shouldn't be worried about being sued and losing everything that you have, especially after coming out of a pandemic. So we're continuing to push that safe harbor, limited liability protection.
Great. And we truly appreciate that because it, you know, we were almost there, and we, you know, certainly commend the House and the Senate for getting it to his desk. And don't know what happened after that, right? But all we can do is push for it to get there again. And we appreciate you doing that. I know our again, our chambers throughout the state truly support that, every chamber that I've talked to. So thank you so much. Are there any other questions or comments from anyone? I don't want to keep us past our time, but I want to make sure everyone has fair chance to ask their questions. And I truly appreciate you all joining us, as Senator, the commissioners, and Jean, for your time this morning. It's been certainly valuable.
Gina, thank you for doing this.
Thank you, Gina. Great to
Sure.
see everybody.
You too.
Thanks,
Great to
Gina.
see you all too. Thank you. Have a great day, everyone.
Take care,
Be
everybody.
well.